Did you know that pelvic inflammatory disease, or PID, can silently damage your reproductive health if not treated properly at home? If you've been diagnosed, knowing exactly what to do after leaving the clinic can make all the difference, from preventing complications to protecting your fertility. In this video, we'll break down everything you need to know about caring for yourself at home, including medications, warning signs, lifestyle tips, and prevention steps, all in simple, easy-to-follow guidance. Stay with us, because these life-saving tips could protect your health and future fertility. Let's start by understanding what pelvic inflammatory disease is and why it matters. PID, or pelvic inflammatory disease, is essentially swelling and infection of a woman's reproductive organs. These organs are located in the lower belly, also called the pelvis, and when they become infected, it can cause serious complications if not treated properly. So, what organs are we talking about? Let's break it down. Ovaries. These are the organs that store your eggs. Fallopian tubes. They connect the ovaries to the uterus, allowing eggs to travel. Uterus, or womb. This is where a baby grows during pregnancy. Vagina. The pathway that joins the uterus to the outside of the body. Now, how does pelvic inflammatory disease happen? Most of the time, it's caused by infections you can catch during sex, like chlamydia or gonorrhea. If pelvic inflammatory disease is left untreated, it can make these organs swollen, sore, and even scarred. Scar tissue in the fallopian tubes can lead to difficulty getting pregnant, and in some cases, the infection can spread to other parts of the body, causing even more serious health problems. That's why understanding pelvic inflammatory disease and knowing how to care for yourself at home is so important. It can protect your reproductive health and prevent long-term complications. Once you leave the clinic or hospital after a pelvic inflammatory disease diagnosis, what you do at home is just as important as the treatment you received. Talk to your doctor. The first step is to have a clear plan with your doctor. Ask them exactly what you need to do after going home. Never hesitate to ask questions if something is unclear. It's your health, and you have the right to fully understand your care. Following your doctor's instructions carefully will help you recover safely, prevent complications, and get back to your normal life faster. Notify your partners. Another important step is to inform anyone you've had sex with in the past 3 to 6 months. They may need to get tested and receive treatment too. This is not about blame, it's about preventing reinfection and protecting everyone's health. Remember, taking these steps seriously is crucial. Clear communication with your doctor and responsible action with your partners can make a huge difference in healing quickly and avoiding further problems. After starting treatment for pelvic inflammatory disease, follow-up care is a critical part of your recovery. Regarding follow-up care, your doctor may ask you to return to the clinic for follow-up visits. These appointments let your doctor check your progress, monitor healing, and identify any complications early. Sometimes, additional tests may be needed to ensure your reproductive organs are recovering properly. Skipping these visits can put your health at risk, so always keep your scheduled appointments. Regarding medications you may need, your doctor may prescribe medications to help with your recovery. These can include drugs to reduce pain and swelling, helping you feel more comfortable, and antibiotics to fight the infection, targeting the bacteria that caused pelvic inflammatory disease. It's very important to finish all your prescribed medications, even if your symptoms improve quickly. Stopping early can allow the infection to come back stronger and increase the risk of complications or reinfection. By following up with your doctor and taking all medications as prescribed, you give your body the best chance to heal fully, protect your reproductive health, and prevent long-term issues. Recovering from pelvic inflammatory disease can affect more than just your reproductive organs. It can impact your daily life too. Regarding impact on daily life, pain caused by pelvic inflammatory disease may make certain activities uncomfortable or even painful. You might notice that tasks you usually do with ease, like lifting, bending, or even walking long distances, can feel more difficult during recovery. Listening to your body and pacing yourself is essential. Pushing through pain can slow your healing. Regarding sexual activity, sex may also be painful while your body is healing. It's important to avoid sexual activity until you have finished your entire course of treatment, and your doctor has confirmed it is safe to resume sexual activity. Why does this matter? Following these guidelines is not just about comfort. It prevents reinfection, reduces complications, and allows your body to heal fully and faster. Remember, taking a little extra care now protects your reproductive health and overall well-being in the long run. Understanding the potential complications of pelvic inflammatory disease is critical. It can help you take your recovery seriously and protect your long-term reproductive health. Regarding reproductive health risks, pelvic inflammatory disease can cause scar tissue in the fallopian tubes, which may make it difficult to get pregnant. Some women also experience chronic pelvic pain, which can persist even after the infection is treated. Additionally, abnormal menstrual periods can occur, signaling that your reproductive system is still affected. Regarding pregnancy risks, pelvic inflammatory disease can also increase the risk of ectopic pregnancy, which happens when a fertilized egg grows outside the womb, usually in a fallopian tube. This is a serious and potentially life-threatening condition, so prevention and careful management are crucial. Regarding other health risks, even after treatment, pelvic inflammatory disease can happen again if reinfected. The infection may spread to other parts of the body, leading to further health complications, and you may also face an increased risk of bladder infections. Why does this matter? Knowing about these potential complications encourages early treatment, careful monitoring, and strict adherence to your home care plan. By staying informed and proactive, you protect your fertility, reduce the risk of long-term pain, and support your overall health. Prevention is one of the most important steps you can take to protect your reproductive health and avoid the serious complications of pelvic inflammatory disease. Let's go over the key ways to stay safe. Regarding key prevention steps, avoid douching. While it may feel like cleaning, douching can actually change your vaginal environment and make it easier for harmful germs to grow. Abstain from sex. The only 100% effective way to prevent pelvic inflammatory disease and other sexually transmitted infections. Avoid contact with partners who have infections. Even if they show no symptoms, they may still carry germs that can lead to pelvic inflammatory disease. Regarding safer sexual practices, if you are sexually active, you can lower your risk with these steps. 1. Use latex condoms every time. This helps reduce the chance of infection dramatically. 2. Limit sexual partners. Ideally, maintain one long-term partner who has been tested and is known to be infection-free. 3. Get regular STD checkups. Catching infections early can prevent them from progressing to pelvic inflammatory disease. Why does prevention matter? Because taking these steps protects your reproductive health, reduces your risk of pelvic inflammatory disease, and lowers the chances of infertility or other complications. Remember, Prevention is the first line of defense. The choices you make today can protect your health and your future fertility. Knowing when to call your doctor or seek emergency care can make a huge difference in your recovery from pelvic inflammatory disease. Let's break it down. Seek emergency care immediately. Some symptoms require urgent attention. Call 911 or go to the emergency room if you experience the following. 1. Severe allergic or reaction symptoms, like wheezing, chest tightness, or trouble breathing. 2. Swelling of your face, lips, tongue, or throat. 3. Blue skin color or seizures. And 4. High fever or severe itching. These signs can be life-threatening, so don't wait. Seek help immediately. Call your doctor for infection signs. Other signs which indicate your infection may not be under control include the following. 1. Fever of 100.4 degrees Fahrenheit that is 38 degrees Celsius or higher. 2. Chills, a very sore throat, or pain with urination. 3. Blood in urine, mouth sores, or wounds that won't heal. 4. Anal itching or pain. Regarding other warning signs, pay attention to additional red flags as listed below. 1. Smelly vaginal discharge. 2. Persistent vomiting or loose stools. 3. No improvement in 2 to 3 days or feeling worse. Why does this matter? Because seeking care early can prevent serious complications, protect your reproductive health, and keep you safe. Remember, trust your instincts. If something feels seriously wrong, it's always better to call your doctor or seek emergency care right away. Your health and safety come first. Before you leave the clinic or hospital, it's crucial to make sure you truly understand your care instructions. That's where the Teach Back method comes in. What is Teach Back? Teach Back is a simple but powerful method to confirm that you understand important health information. After talking with the medical staff, you explain in your own words what you learned. This helps clarify anything that may have been confusing or unclear, so there are no surprises when you're at home. Before going home, make sure you can say, 1. I can tell you about my condition. 2. I can explain how to prevent this health problem. 3. I know what to do if I have a fever, chills, pain with urination, or smelly vaginal discharge. Why does this matter? Because using the Teach Back method ensures a safe recovery at home, protects your reproductive health, and helps prevent complications or reinfection. Remember, asking questions and repeating instructions in your own words is not silly, it's smart. It gives you confidence to take control of your recovery and protect your long-term health. Learning more about pelvic inflammatory disease and how to care for your reproductive health is always a smart choice. Reliable information helps you stay safe, understand your treatment, and make informed decisions. Here are some trusted sources you can check out. 1. American Sexual Health Association. Their website has a wealth of information about pelvic inflammatory disease, STDs, and sexual health. You can visit them at ashasexualhealth.org/STDs/PID. 2. Kids Health. A great resource for clear, easy-to-understand explanations about pelvic inflammatory disease and infections. Check it out at kidshealth.org/parent/infections/STD/pelvic_inflammatory_disease.html. 3. Royal College of Obstetricians and Gynecologists offers patient information leaflets that are detailed, medically accurate, and easy to follow. Visit them at rcog.uk/global-assets/documents/patients/patient-leaflets/gynecology/PI acute-PID.pdf. Taking a few minutes to read these resources can help you feel more confident about managing your recovery, preventing future infections, and protecting your reproductive health. Remember, knowledge is power, and being informed is one of the best ways to care for your body and your future. Thank you so much for watching. By learning how to care for yourself at home, you're taking control of your health and protecting your reproductive future. If you found this video helpful, smash that like button. It helps more people find this life-saving information. Don't keep it to yourself. Share this video widely with friends, family, or anyone who could benefit from knowing how to prevent, treat, and recover from pelvic inflammatory disease. And don't forget to hit the notification bell so you never miss another important health video from our channel. If you want more tips, updates, and educational content, subscribe now. Join our community of informed viewers taking charge of their health. We'd love to hear from you. Comment below and tell us, what part of today's pelvic inflammatory disease care tips surprised you the most, or what helped you the most? Your questions and experiences could help someone else too. Remember, your health matters, your recovery matters, and staying informed is the first step to a healthier, safer you. Thanks again for watching, and we'll see you in the next video.